Yeah, and kind of share the same field of thought with Dr. Hamza. Dr. Hamza, when we look at healthcare access, what are some of those most promising innovations in digital health that could transform healthcare access for the next 5 years or for the next future?
Yeah, so James, when we look at healthcare technology in general and its role in access, we have to be aware that there are a lot of things that are happening right now that are informing where we are going in the future. So right now, the three things that you should never ever ignore when you are thinking about things like this is in the space of AI. You should never stop thinking about issues around blockchain, and you should never stop thinking about things around the area of what I call telemedicine 2.0. So you will remember, James, that when we met back in 2019, you remember all the telemedicine we talk about is what I call telemedicine 1.0, because we had simple platforms. We had people who would just go on those platforms, try to connect with the providers through those platforms. Providers try to offer them services, and it ends there, right? We are getting into a space where in the next 5 years we need to see, yes, technology and telemedicine and all these things have come up. I can't even tell you the number of healthcare entrepreneurs, especially from Africa, who reach out to me every single day with an idea that they think would change the world. But then these ideas, in my opinion, are things in the past, because yes, we still have the same technology in play, but how you use that technology is what would inform how the future of healthcare access and innovation will look like. Let me break this down. So when you look at things like AI-driven services, AI is everywhere. From ChatGPT, which is free and is open to everybody, to now what we call hyper-personalized care. So we have AI hyper-personalized care, which now goes to the extent of playing into the needs, the special needs of every single human being. So when we look at apps like the Nightingale app, which is used in cardiovascular diagnosis and all that, this has gone beyond just using ordinary AI tools to a point where it's been trained in so much diverse information, like Rofi said, because people realized that at some point, a lot of the bias was skewed towards the white population. So when these same tools were applied in the black population, there were discrepancies. So now where the hyper-personalized care comes in is training models. Any model that comes up has to have the ability to interpret accurately across any diverse population you have. So anybody who is looking at the future of healthcare has to start looking at this level of hyper-personalized care. Secondly, we need to look at what I call telemedicine 2.0. What does this entail? AI. We'll keep hearing AI in all our conversations today because this is the age of AI. If you are in this world right now, in any industry at all, and you have not adopted any form of AI tools in your workflow, then you are way back in the past, because you should have some basic AI tools running right now. But in addition to what me and you, James, what we did in 2019, we need to start looking at incorporating AI platforms into these platforms that we already have. And we need to start now even advancing it to what I call Internet of Things, or what is called Internet of Things, where now we are able to incorporate all these different items into these platforms to create a more personalized approach to how people are taken care of. But most importantly, these have to be integrated with community health workers, because if you want to deal with access issues or access challenges, you cannot do them without considering community health workers. So building that platform is not enough. Incorporating AI into it is not enough. Incorporating Internet of Things into it is not enough. If you don't add the people who are going to implement and use these tools to be able to reach millions of people, then it's going to be a challenge. Look, people who have built tools like this in the last year have been able to reach at least 2 million people. And it's not because of how sophisticated the technology was, it's because of every single component that they integrated together in that 2.0 version to be able to get to the people. So that's the second thing you need to look at. The third thing that I want to talk about is in the space of wearables, because that's where we are going. at first, all those the technology we have now would focus on mainly fitness. So a lot of fitness wearables that are in the system right now. So, but now it's getting to a point where it's becoming very and highly clinical, where people with chronic conditions can have wearables that would actually help the doctors or help prevent a lot of cardiac episodes. It would help people report early when they start seeing symptoms that are not appropriate. It gives doctors the opportunity to remotely monitor the vitals of patients. So if, James, you call me, I should be able to, through your wearable, see all your vitals and be able to make an informed decisions. In the next 5 years, this is where most of the innovations are going to be developed in. The deeper you go in any of these fields, the more and the higher your chances of actually taking over or getting ahead of the curve when it comes to being like in the competitive curve. So as far as we are concerned right now in digital health, you cannot do that without thinking about AI. You obviously also cannot do that without even digging deeper into looking at more of hyper-personalized care, any tool that does that. The last item I would like to add, and this is an industry that most people have ignored, is what we call this the aging population, right? This is a potentially $1.5 trillion industry, where now when people are aging, they want to age, or what we call, they want to age in place. What that means is they want to be as functional as they can in the communities that they live in without having to go to a nursing home or somewhere that they would have to have people poke them every day of their lives. So anything you are thinking about in these three spaces that I just mentioned, think about how you can even personalize these further to the aging population, because there's a lot of untapped resources, a lot of untapped investments that haven't happened in that space yet. Try to push most of the efforts towards there, and if you can monitor how many times your mother falls. My mom lives alone. She lives alone in her home. When I see things like this, I'll be happy to know what my mother's blood pressure is right now, right? And that comes with wearables. I'll be happy to know how many times my mom fell today, because then it will inform whether or not we need to have a family member live with her. So these are things that I will happily invest in, because I don't have geographical access to her right now. And so once you're thinking about healthcare, these are major areas that we need to start thinking about. And I think once we pay more attention to it, it's going to be a very, very, very interesting 2030 when we get there.